It's well documented that earlier this year, serious problems surfaced at VA. Process issues, what I call business process issues, like improper scheduling practices and an antiquated scheduling system. Leadership failures, like our misuse of metrics and our failure to hold people accountable for negligence and misconduct. And then lastly, resource shortfalls, in some cases chronic resource shortfalls. Persistent lack of sufficient clinicians, patient support staff, space, IT resources, and purchase care funding to meet the current needs, not the future needs, but the current needs for timely, high-quality health care. And the good people at the San Francisco VA Medical Center are familiar with many of those particular shortfalls. As a result, veterans were and still are waiting too long for care. Well, we have moved out smartly on 3 fronts. First, rebuilding trust with veterans and other stakeholders. Second, improving service delivery, focusing on better veteran outcomes. And third, setting the course for longer-term excellence and reform. We've recommitted the department to our mission, to care for those who have borne the battle, and to our values: integrity, commitment, advocacy, respect, and excellence. I care. We all wear this now. We're also working hard to create a climate that embraces constructive dissent and welcomes critical feedback. It also ensures accountability for misconduct or management negligence have occurred. I talk about that as being willing, having people that are willing, not just afraid, but anxious to raise their hand when they can offer up suggestions for how we can do things better, how we can deliver better veteran outcomes. In the arena of accountability, as investigations have been completed, personal actions have been announced. You've seen some of those in the papers, including a number of senior executive removals. Many investigations are ongoing. The VA Inspector General, the Department of Justice, the FBI, the Department of Special Counsel. In each case, as the investigations are completed and the evidence is delivered, my promise is that we will take appropriate action in every case. I watch the tone and tenor. One of my most depressing activities each day was to start the day reading the clippings. It's not so depressing anymore. There's still plenty of issues and articles that get raised, but the conversation has begun to change already. I would not have thought we could change it that quickly. And I would tell you, we are determined to get the good story out. Because today, there were 300,000 instances of great outpatient care. Today. You're not going to read about that in any newspaper. We've got to tell it.